Well, thank you for that introduction, Deborah. And you know what? It's exciting for me to be here. Such a beautiful place where the people who live here think 93 degrees is a cooling spell. You know, I think in Chicago they should come and really see what cooling spell is all about. But I'm very passionate about diabetes and what we're doing in Illinois as public policymakers to kind of address some of the issues that we're seeing in our state and looking forward to the future. And what the Illinois Legislative Diabetes Caucus is really about, kind of on a bigger picture level, is really two things. It's about getting stakeholders and policymakers together and talk about public policy, and we think only good things can happen if we do that. But more importantly, it's about getting legislators to reach inside their districts and provide constituent outreach services and get them engaged in the issues that revolve around diabetes. So let's see, how do I operate this? Down, up?
Left, right.
Left, right, okay. So in order to understand my commitment to this issue, it's nice to be in a room of people who know what being around a legislative chamber is like. When I got to Springfield in 2005, I didn't realize that you didn't break for lunch, you didn't break for dinner, there were no bathroom breaks, you ate at odd hours, people had food in the back of the chamber, you did whatever you could to get nourishment, and it wasn't healthy nourishment. And in fact, in our state, in the bottom of our Capitol building, they have this thing called the Capitol Bistro, and it sounds like a really good place to eat. And they actually really specialize in one thing very well, and that is they take really good food and make it really bad. And you can see the chili there that's floating in grease, and combine that with the legislative receptions, and you're eating hors d'oeuvres and you know, things that look and smell good that you're not supposed to have too much of, you're indulging in. And lo and behold, at the end of the first legislative session, I was diagnosed with type 2 diabetes. And you can see I had, for some reason, had a physical just before the election, and everything was looking good. I came back, I was exhausted for about a week. My doctor said, you know, did a blood test, did a whole workup, called me and said, "What are you eating down there?" And I said, "Pretty much steak." She says, "Every night?" And I said, "Well, yeah, pretty much, you know." And so that started my journey with diabetes. For about a year, I did diet and exercise, year and a half, and then I was medicated shortly after that. And I remember the day I got medicated when it was very depressing to me to be told they were going to have to put me on medicine. So I drove home and I got my prescription filled and went home, told my wife, and we ate dinner. And just before the news, a TV commercial came on that said, "Have you or any member of your family taken the diabetes drug Avandia? You may be eligible for a class action lawsuit." I said, "I think that's what I just took, you know." And I got up and I looked at it, and sure enough, and I was on Avandia for a long time, and I think it was a drug that got a really bad rap, quite frankly. But that doesn't scare you, and you don't start thinking maybe this is a sign from someplace else that maybe you're not supposed to take this drug. But that's the kind of problems people have when they have diabetes, trying to educate themselves and trying to sift through this unbelievable amount of data. And I, like many people, would go on the internet and research out things and get good information and bad information. But when you get diabetes, you become committed to it, or you know, you don't have success in treating it. So what I found out over the course of the next 2 years was that there were other people in our chamber. We have 118 members in our House chamber, and we had 4 that actually had diabetes. I was not the only one. We had 2 that had children with type 1 diabetes that were very much interested in these issues. We also have the highest incidence of diabetes anywhere in the country in one of our neighborhoods in Chicago called Humboldt Park, where 21% of the population is diabetic, and so we had enough people to have some interest. And I went to dinner with a couple of the farmer representatives, and I said, you know, I'm kind of thinking about maybe we should get all the legislators together that have an idea or have an interest in diabetes and look at doing a diabetes caucus. And I no sooner got those words out of my mouth and they said, you know, that would be a fantastic thing to be looking at. So we got these group of people together and we put together you know, some facts about diabetes and started talking about them in our chamber. But right now in Illinois, about 9.5% of our population has diabetes, type 2, about of that, anywhere you go, about 10% of the total number of diabetics is generally type 1, maybe a little bit less than that. But CDC estimates about 20% of our population in the year 2025. I know Dr. Rowley had that on his thing. And then, of course, with Humboldt Park having 21%, and what they're doing in Humboldt Park has been phenomenal. They're doing block-to-block programs where they go door-to-door and they're testing people and so forth. And we're finding all kinds of data, and that's being done through a CDC grant. So we try to draw all those things into our process when we started talking to other legislators. But if you look at what's going to happen, California, $63 billion in the year 2025. Californians will pay to treat this disease. But if you look at Illinois, we're going to spend about $19.67 billion. That includes our what we spend as a state and what people will spend on treatment. No state is really ready to handle this type of consequences from having a disease that's growing at 8% a year, and therefore to have discussions about public policy in the legislative arena, I think, is very prudent and wise for any General Assembly to deal with what we're about to see. I mean, most people don't understand, but these are the top 10 states. So what we did is, to form a caucus, we obviously put together a steering committee and adopted a resolution to do so, came up with some bylaws, looked at what our strategic goals would be and what we could maybe try to accomplish as legislators. And we actually created 2 caucuses. We created the Illinois Legislative Diabetes Caucus, which consists of legislators, and the Illinois Legislative Diabetes Caucus Foundation, which consists of non-legislators. And the reason for that, when you have a state who sent its last 2 governors to prison, having a foundation that would handle the money and take care of any kind of interaction with potential donors would be a much better ethical solution than having legislators do it. And the second thing is, if we put non-legislators in the foundation, it will maybe outlive the life of those who have started it. You know, one staff member once told me legislators are just a passing parade, and I didn't actually take that very well, but I thought about it, and she was absolutely right. You know, we're probably going to have 35 new members in both of our chambers. So, you know, it consists of 12 people. You know, the caucus, the legislative caucus exists to appoint them, but those 12 people then will have their own ability to create where they think we should go as a legislative caucus with policy decisions and so forth. They'll have strategic goals that we'll work together with, but they're going to apply for grants, and which we're in the process of doing now, hire staff if we get the ability to fund that and so forth. And then what the Legislative Diabetes Caucus will do, we have obviously the 4 House Republicans, House Dems, Senate Republicans. Each will make appointments of 3 to the board, and then we're basically there to discuss public policy, look at legislation, evaluate initiatives, work with the caucus and help them in their event of raising money and so forth, and do some strategic planning with this. Our goal is to primarily educate legislators on the issue and what kind of public policy is in place and needs to be changed. It's also to be able to reach out with community service outreach programs in each of the legislative districts, of which we did 5 of last year, where we team up with a local hospital with the legislators, and they team up then with all the stakeholders such as drug companies, and even Seattle Sutton comes, and we have a day. And when we've done that, I did the first one. There were about 1,000 people that came through that Diabetes Awareness Day. My hospital loved it. They had it on the radio. They had done all kinds of publication. And what was interesting is that was a kind of goodwill that a legislator can't pay for. I mean, you can't, I mean, if you can get 1,000 people to come to an event, that's a good thing. If we can get all of our legislators to have these and have 1,000 people come to an event like that, then more of our legislators will want to be involved in it. And then the issue of diabetes will become something that our legislators are educated on and willing to work on, and they'll know how it affects their districts and so forth. We also are wanting to put together an annual stakeholders event. We did our first one last year, and the stakeholders event probably had somewhere around 100 people there, and it was good to see that happen. This is a copy of our website. If you'd like to go to our website, it's ilgadiabetes.com. We announced this caucus April 1st, 2011, and we've done a lot of things in a year as a group of 49 legislators. It's been pretty exciting to be a part of. We also have 80 affiliate members. We've now hosted 2 lobby days where stakeholders such as the Kidney Foundation, our pharmaceutical companies, ADA, JDRF all come to Springfield, and we set up a luncheon inside of the Capitol building, and they get paired up with their legislators, and I think there was a couple people here that were there, and that has gone over very well. And like many states, Illinois is in the middle of reforming its Medicaid program, and of course part of that reform is limitations on drug prescriptions, and so I think it was good for the pharmaceutical industry to be a part of this lobby day and kind of educate our members on what the proposals we're going to do. We are at Humboldt Park, the area we have the highest diabetes. We've attended a festival there last year, brought in the Kidney Foundation people to do some testing and so forth. So we've been able to do a lot of things. Last year we passed what was called the Student with Diabetes Care Act in Illinois. We had schools that would tell a child with diabetes they couldn't go to that school because they didn't have a nurse there, and they'd have to go on the other side of the county. In some cases it was very difficult to get the child there, but more importantly the child didn't get to go to school with their brother, their sister, their friends. And so what we did in many cases, a diabetic child knows as much about how to take care of themselves as anybody. And we passed that every school had to have somebody designated as a person who could oversee the child with diabetes and be able to help administer drugs, keep the drugs, and make sure that they had a resource there for that. Parents have to sign a waiver for that to happen, that they're good with their child being in that part of a care program. It's been very successful. Schools came kicking and screaming, but as we got some education, one of our universities is helping educate them and so forth, so that's going to work out good. We've had, one of the problems that I see across the country, which we're going to try to work on, is just as important as the drug is in diabetes, the education is. I mean, treating diabetes is just half of it, making sure people understand and have the education. The only state that I know of that pays for diabetes education in their Medicaid program is New York. I don't know if there's any other states that do that, or you know of any other state. That's obviously a big cost, but that has to be solved somehow. I mean, people that have diabetes who are on Medicaid need education, and it needs to be reimbursable. We had a situation in Illinois, and I filed legislation on that, where we would give education to somebody that had gestational diabetes, and then we would, when they were when they were done with the pregnancy and the baby was delivered, they had to, within a couple of weeks, come back and they did a blood test to see if they still had diabetes, and if they did, nothing happened. They gave them no education, no treatment, nothing else, and so we were trying to work on that. That bill's been filed as well. So, this year primarily we're focusing on these in-district events, and we're hoping to have by next year 20 of these events throughout the state, where legislators will reach out to their constituents, and the hospitals have all the mailing lists of all the people who are affected by diabetes, and that's gone over very well. And we're trying to develop our caucus funding sources. So where are we now? We have applied for a 501. Go ahead. Okay.
What do you mean develop caucus funding sources?
I'm getting to that. Okay. So we applied for a 501(c)(3), and so we're in that process now, which this year has been our biggest challenge because of the ethics laws that we have in Illinois. In fact, the ethics laws in Illinois have gotten so stringent that the first publication we developed with the Legislative Printing Unit had a list of websites and resources: American Diabetes Association, JDRF, Kidney Foundation, all of which were nonprofits. We couldn't list those on there because they take private donations. Therefore, we couldn't have that printed. So talk about having the pendulum go way too far. That's the case. And getting just the ability to create this foundation through the Office of the Executive Inspector General and the two chambers ethics officer was a challenge. We got that done. We then approached the University of Illinois at Springfield, who operates a legislative internship program, and approached them about the possibility of them giving us 2 interns and so they thought about it. We laid it out. They came back. They said we could be really excited about this if we could get the funding to have 2 of our MPH programs, master level public health graduate students be a part of this, and as from an educational standpoint. So what we're doing now is they are actually in the process, as we speak, of applying for grants through some of the pharmaceutical foundations, through our own hospital association, our own medical society, and also with CDC. And then our state has some grant money we think that will come into this. And so that is what we're hoping will happen. We're hoping for a staff of 2 people. They would be housed. We worked out with the ADA that Springfield has an ADA office there, that they would be housed in Springfield and work on all of these caucus goals. And when we had to submit our legislative our 501(c), we had to come up with a budget. So we think actually about $150,000 is enough to fund 2 interns and do the things that we want to do. And we put into that budget up to $225,000 a year. We'd like to do this for a couple of years to see how much impact we can have with the legislative offices. And my philosophy has been, and the philosophy of those that have been working on this, if we can give the legislators to the table through public outreach, it will be a tremendous thing. And I saw a bumper sticker this year, and I think Dr. Rowley almost said something similar to this. And the bumper sticker said, "If the people lead, the leaders will follow." And everybody in this room can make a difference when it comes to diabetes, and especially those who are in the pharmaceutical industry, especially those who are in the nonprofit stakeholders groups, because if you go to your state legislature and say, hey, this is what Illinois is doing, this is what North Carolina is doing, they pay attention to that. I mean, the pharmaceutical industry, we see every day in our offices from working on issues and lobbying, and we generally tend to want to do things to work together on, and I think just asking is one of the things to make this work. So we've been kind of excited about starting this. I don't have all the bills that we had filed this year. We had several bills. We had a person call our caucus staff person that we have now, worked for a national home improvement store, had their self-insured plan, and had saved her money to buy an insulin pump, and was told by their insurance company that the only insulin they covered was generic insulin. For those of you who are in the pharmaceutical industry or have diabetes, there is no such thing as generic insulin. And what we called and found out, they only covered Rely-On insulin, which is sold by Walmart, manufactured by Lilly, but not something you could use in a pump, and not something that was really designed for good control of type 1 diabetics. So we looked into that, found out that under the Affordable Care Act, if it's a self-insured plan, states can't legislate it. We can only legislate the insurance that's being sold outside of that. So that was frustrating, but in that process, they actually changed their policy and started covering insulin, because our state actually has a law that says you have to pay for insulin. And we were, I think, able to head that off. Now, I filed legislation, and the insurance company came to me and said they didn't really want to come into committee and have a big be beat up on. And I said, well, let's have a discussion about this. And so that plan now does include insulin coverage. So you'll get, I think if, for us, we've just had so many good things start to happen when it came to diabetes, just getting our colleagues aware of it, that it's been great. So with that, are we going to wait for questions?
Let's
Okay.